Welcome to the lecture on CPAP, which is continuous positive airway pressure. CPAP works by providing continuous pressure both during inspiration and expiration to the small end air sacs called alveoli, where oxygen and carbon dioxide are exchanged. As the result of increased pressure to the alveoli, O2 flows into the capillaries more quickly. Increased pressure also pushes fluid out of the alveoli, as in conditions such as congestive heart failure, and improves gas exchange. Increased pressure also maintains an expanded alveolar shape, increasing the surface area for gas exchange. Indications for CPAP include respiratory distress and a probable respiratory illness, failure of routine measures to alleviate respiratory distress, and the patient meets criteria for use. Respiratory illnesses that may be helped by CPAP include congestive heart failure, COPD, asthma, and pneumonia. It's important to remember that routine treatments for respiratory distress should be attempted first. Those include oxygen, positioning of the patient, nitroglycerin when indicated, and albuterol inhalers when indicated. There is specific criteria for CPAP use. First, the patient needs to be awake and is able to follow commands. Next, the patient must be over 12 years of age, and it must be possible to fit a mask to the patient. Thirdly, the patient must be able to maintain their own airway and has 2 or more of the following criteria: respiratory rate greater than 25, O2 saturation less than 94% at any time, and the use of accessory muscles. The contraindications for CPAP use includes apnea, suspected pneumothorax, traumatic chest injury, tracheostomy, active vomiting, and upper GI bleeding. The CPAP generator increases the pressure by the Venturi effect. The tank pressure is forced from a small to a large tube, increasing the pressure but decreasing the flow rate. It's important to remember that the generator pulls in a large amount of ambient air that mixes with the tank oxygen. The resulting FiO2 is only about 30%. To assemble the whisper flow CPAP, first attach the O2 valve to the tank. The O2 valve is then attached to the CO2 coupler. The O2 coupler is then attached to the CPAP generator, which goes onto the corrugated tubing that is then attached to the mask. Place the straps on the mask and put the 5 centimeter PEEP valve on the mask. To assemble the whisper flow device, first attach the valve to the tank. Make sure that the holes are aligned before tightening the clamp. The next step is to attach the CO2 coupler. Again, make sure that the holes are aligned and it will snap into place. From there, the tubing is attached to the CPAP generator. Make sure that all the connections are tight. The corrugated tubing goes onto the CPAP generator, which is attached to the CPAP mask. We always use the 5 centimeter CPAP valve on the mask. The straps will snap into place on the mask. Additional attachments can be used when needed. For patients that require more than 30% FiO2, a tube can be attached from the tank to the CPAP mask port. In environments with significant smoke or dust, a filter can be added to the CPAP generator intake valve. For dusty or smoky environments, apply the filter. If more than 30% FiO2 is required, an oxygen tube can be placed on the oxygen valve and then attached to the CPAP face mask. At 15 liters, 60% FiO2 will be supplied to the patient. Procedure for CPAP use includes preparation, which involves educating the patient regarding the mask and what they will feel, which is a constant pressure while breathing. Check the O2 supply to the device. Put the patient on oxygen monitoring. Position the patient at 45 degrees or the position of greatest comfort. Procedure for CPAP use. Place the best fitting CPAP mask over the mouth and nose, secure with straps provided. Check for air leaks. Adjust straps as needed. Make sure the oxygen is turned on completely. Procedure for CPAP use and monitoring. Use the CPAP monitoring form to document the patient's status in response to treatment. Check the patient's status and vital signs every 5 minutes. Check the patient's mask position frequently to ensure that optimal oxygen and pressure are delivered. Disposition of the patient is important. Transport the patient as soon as possible. Remember, most of the time, CPAP can be started while in the ambulance. Contact the receiving facility or transport agency and inform them that CPAP is being used. Request ALS backup if available. Continue treatment specific to the illness as per the protocols. Normally, the CPAP will come pre-assembled in the bag. After educating the patient, select the correct mask size. Place the mask on the patient. Secure the mask to the patient with the straps provided. Tighten the straps securely so that there is a good seal. Make sure that the oxygen valve is turned on completely. Check that there are no air leaks around the mask. Tighten the straps as needed to complete the seal. This demonstrates air being released from the CPAP valve and suction at the CPAP generator. CPAP should be removed for the following indications. The patient is unable to tolerate the mask. If there is respiratory arrest. If the patient is vomiting. If the mask needs to be removed for intubation by ALS or pneumothorax. CPAP removal considerations. Use the bag valve mask assistance for impending respiratory arrest. Use the King airway for respiratory arrest. Special considerations for the CPAP include: do not remove at the receiving facility until the staff are prepared and ready. The CPAP may be used for DNR patients.